Should brain stimulation therapies be used in efforts to rehabilitate psychopathic criminals? A presentation by Maya Rodriguez and Lauren Perez. To start off, the term psychopath is often associated with serial killers. Through media portrayal of individuals such as Ted Bundy and Richard Ramirez, the general public has been led to believe that all psychopathic individuals are dangerous and murderous, when in fact, psychopathic behavior is found among a wide variety of individuals, not just murderers. Many of these individuals are found to be engaging in antisocial behaviors that is far less delinquent.
The Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, replaces the term psychopathy with a condition called antisocial personality disorder. It is characterized with the appearance of 3 or more of the following characteristics: failure to conform to social norms with respect to lawful behaviors, deceitfulness, impulsivity, aggressiveness, reckless disregard for socioeconomic responsibility, and/or lack of remorse. As an aim to understand the nature of such psychiatric conditions, mental health professionals have used recent empirical evidence to develop treatment methods for individuals who engage in psychopathological behavior.
In 2009, the triac model of psychopath was developed to introduce the 3 behavioral phenotypes of the psychopathic personality: disinhibition, which includes difficulties with emotion regulation; boldness, which includes a need for social dominance; and meanness, which includes a lack of remorse.
Robert Hare's Psychopathy Checklist Revised sheds light on the limitations of both the DSM-5 diagnosis as well as the triarchic model of psychopathy. The diagnosis established by the DSM-5 and assessment protocols such as the triarchic model of psychopathy failed to truly understand the complexity of psychopathic neurodevelopment. Hare's Psychopathy Checklist Revised is an attempt to understand psychopathy from a dimensional perspective, determining the severity spectrum that associates specific personality traits with antisocial behavior. This assessment is a 20-item interview that is designed to assess an individual's psychopathic behaviors as well as their risk for relapse in criminal behavior and individual potential for rehabilitation. This assessment is scored on a 0 to 40 scale that is commonly presented in criminal proceedings. For example, Ted Bundy scored 39 out of 40 and was therefore deemed untreatable, as well as an imminent danger to society.
Given the substandard nature of clinical interventions and diagnostic systems such as the DSM-5 and Hare's Psychopathy Checklist Revised, the complete understanding of what goes on in the brain of a psychopathic individual is extremely unlikely. Empirical evidence is beginning to point out the specific neurobiological abnormalities in the psychopathic brain that most likely serves as a biological basis for such antisocial behaviors. Structural abnormalities and the deficient cortical inhibitions in the ventromedial prefrontal cortex and the dorsolateral prefrontal cortex leads to diminished capacity for operant learning and impairs executive functioning. Dysfunction of the orbital frontal cortex diminishes one's ability to process others' emotions. In addition, decreased amygdala volume has been associated with high levels of violence and aggression.
Transcranial direct stimulation, or TDCS, is a form of neuromodulation that uses constant low direct current delivered via electrodes on the head through the skull. It was originally developed to help patients with brain injuries or psychiatric conditions like major depressive disorder. It can be contrasted with cranial electrotherapy stimulation, which generally uses alternating current the same way. Research shows increasing evidence for TDCS as a treatment for depression. there is mixed evidence about whether TDCS is useful for cognitive enhancement in healthy people.
Brain stimulation therapies should be used in efforts to rehabilitate psychopathic criminals. Electric stimulation is a more humane and ethical approach to treat criminal psychopaths. Non-invasive cortical modulation can be achieved by transcranial magnetic stimulation, TMS, or transcranial direct current stimulation, TDCS. The mortality and morbidity rate of such procedures are significantly low. Long-term modulation has been shown to recruit pathological pathways in the brain.
A recent study showed that transcranial direct current stimulation increases compliance to social norms that are upheld and enforced by the law when the right dorsolateral prefrontal cortex has been stimulated. Studies of neuroimaging demonstrate that the right dorsolateral prefrontal cortex and lateral orbitofrontal cortex are activated when individuals choose to comply to social norms, specifically when punishment is possible. The dorsolateral prefrontal cortex is associated with social cognition and theory of mind, as well as decision-making, while the lateral orbitofrontal cortex is associated with anticipated decision-making by using prior knowledge to influence goal-directed behavior. Stimulation in these areas, as depicted here, would amplify the specific functions that are associated with them, such as theory of mind and anticipated decision-making.
Cortical stimulation remodels abnormal pathological circuits. Cortical stimulation has been proven to permanently change pathological circuits. Long-term modulation can be discontinued once abnormal circuits have been recircuited or remodeled. Transcranial direct current stimulation includes a technique that uses electrical currents to influence the activity of the brain's cortex. By increasing or decreasing activity in the targeted brain regions, certain brain functions can be suppressed. It is commonly used as a treatment for severe cases of psychological disorders such as depression, anxiety, chronic pain, and Parkinson's disease. More recent research has suggested notable improvements in cognitive function and memory formation. A 2020 study involving transcranial direct current stimulation on rats demonstrates cognitive improvement in those with mild cases of Alzheimer's disease and dementia. In addition, a 2019 study involving transcranial direct current stimulation on rats further demonstrated on the notion of neurogenic signaling that is involved in TDCS, exhibiting further that support cells throughout the nervous system are altered after transcranial current stimulation.
Brain stimulation of any kind is invasive and breaks ethical codes, and therefore should not be used as a form of treatment. The two necessary ethical codes in question for transcranial direct current stimulation for psychopathic individuals are individual medical benefit and voluntary consent.
Brain stimulation is an invasive form of treatment, unjustified in a correlational setting. Deep brain stimulation is a form of brain stimulation that is used to target specific brain regions that cannot be reached through the skull surface, such as the amygdala. Given the invasive nature of this form of neuromodulation, it would violate two fundamental ethical codes: individual medical benefit and the incarcerated individual's ability to provide voluntary informed consent. The violation of ethical codes would deem this treatment on an incarcerated population as wrongful medicalization and is arguably rooted in the desire for social control over psychopathic criminals.
The consent of a psychopathic criminal is not voluntary. When offered treatments such as cortical brain stimulation, they are presented with two choices: the medical procedure or imprisonment. So it can be safe to suspect that when an individual agrees to such medical treatment, it is because they feel compelled to do so. it is likely that a psychopathic individual is willing to undergo such burdens of the procedure in exchange for their release from prison. In addition, psychopathic individuals do not necessarily experience subjective suffering, suggesting that they don't always wish to change their antisocial behaviors, which then emphasizes the argument that medical benefit of this procedure is social, not individual. Once a psychopathic criminal undergoes transcranial direct stimulation, the individual is not freed or released from any personal or subconscious distress, but rather the social penalties that are being enforced on them.
Antisocial personality disorder should not go untreated. The contrasting outlooks on the use of neuromodulation on psychopathic criminals both highlight one underlying issue. Antisocial personality disorder should not go untreated. Both sides can agree that there needs to be a form of treatment for this disorder, but having a treatment that can work 100% is difficult to find. More research needs to be done in finding a cure, but until that can be found, effective treatment will still be debated. As additional empirical evidence continues to demonstrate the biological basis for antisocial and criminal behavior, a non-invasive form of treatment seems more feasible.
While there are non-invasive forms of neuromodulation, such medical treatment may not be entirely ethical for psychopathic individuals who are incarcerated because their consent is not necessarily voluntary. Even though the medical procedure itself is non-invasive and the morbidity rate is significantly low, providing such treatment to psychopathic individuals who are incarcerated might be unethical because the inability to make rational and moral decisions intervenes with the informed consent of the procedure. There are also ethical dilemmas of having to use prisoners who are most likely going to choose to be a participant simply because they don't want to be in jail anymore, and that is their most feasible form of escape. There is also no guaranteed cure for a psychopath or antisocial personality disorder, so saying that this treatment is a cure would be misleading and dishonest.